And unfortunately, in modern medicine, we learned a very rigid way of dealing with healthcare. When I was in medical school and in residency, we learned the biochemistry of diabetes, we learned the pathophysiology of diabetes, we learned the pharmacologic interventions of diabetes, and we learned diabetes as though we were dealing with a machine, and the machine is the human body. Well, if we're just simply mechanics, we will never be successful in dealing with problems like diabetes that are not just biochemical, but also cultural and behavioral and social. So the systems of healthcare have to be locally controlled, culturally appropriate, and flexible to meet the needs of diverse populations. And even within one population, you can have tremendous diversity in terms of cultural belief systems and healthcare practices. So it's really the role of the systems to learn to be flexible to meet community needs. The community should not have to become rigid, singular, homogeneous entities in order to meet the needs of the medical field. It's the other way around. So when we think of diabetes in American Indian communities, it's not just about blood sugar. It's not just about the biochemistry of the disease. It's about belief systems and culture and value systems. And the only way we're going to be effective is by working with local community members that are living in a healthy way, and those people need to be the role models. Those people need to be the ones delivering the message of hope that we can prevent diabetes. And there's not an outside entity that's going to change that. It has to come from within the community. And another thing that I've observed is a resurgence of belief in tradition and embracing traditional ways. We've seen language preservation and cultural preservation, and the traditional healers taking a higher presence in the community, in the social structure. Perhaps we'll see a culture of healthy integration of traditional values and beliefs with modern best practices in public health, for example. So that's the type of issue that is moving forward, and I see positive changes in many communities. But it's not something that's going to occur overnight. It takes a while to change cultures.